Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
In the systemic lupus erythematosus, what are the autoantibodies? So, systemic lupus erythematosus, autoantibodies. Okay, autoantibodies in systemic lupus erythematosus are, we have many. First, anti-nuclear antibodies. Anti-nuclear antibodies is actually the best screening test for SLE. This negative anti-nuclear antibody is extremely sensitive. It is extremely sensitive. Negative anti-nuclear antibody is extremely sensitive, whereas positive anti-nuclear antibody is only little specific. Specificity is less, whereas sensitivity is more for anti-nuclear antibody. Next, the second antibody which we have is anti-double stranded DNA antibody. Okay, in anti-double stranded DNA antibody, here there is, these are actually specific. The specificity is more in anti-double stranded DNA antibody, and in fact this anti-double stranded DNA antibody will correlate with disease activity, and also it will correlate with nephritis and vasculitis also. So anti-double stranded DNA antibody correlate with disease activity, nephritis and vasculitis of the patient. Then we have anti-Smith antibody. Anti-Smith antibody can have in anti-RNP antibodies are seen. Anti-Smith antibody, these patients can also have. The patients with anti-Smith antibody can also have anti-RNP antibody. Okay, what is anti-RNP antibody? RNP stands for ribonucleoprotein. Okay, in this anti-RNP antibody is associated with syndromes which have an overlap. Actually, in syndromes that have overlapping features with other rheumatic or with other rheumatic syndromes, with other syndromes other than SLE or including SLE, in them we see anti-RNP antibodies. Then we have anti-Rho antibody. So we have two, which are actually the Sjogren syndrome antibodies, like anti-Rho antibody, that is, or which is also called as SSA antibody. Okay, this anti-Rho antibody is actually associated with Sika syndrome. Then it is associated with subacute cutaneous lupus, and it is also associated with neonatal lupus with congenital heart block. It is associated with neonatal lupus with congenital heart block, and this is actually associated with decreased risk of nephritis. Okay, anti-Rho or SSA antibody is associated with decreased risk of nephritis, but it is associated with Sika syndrome, subacute cutaneous lupus, and neonatal lupus with congenital heart block. Then we have anti-La antibody, or it is also called as SSB antibody. This anti-La antibody is actually associated with anti-Rho antibody. Thus, it is associated with decreased risk for nephritis. The risk of nephritis decreases when the patient has anti-La or SSB antibody. Then we have one more, which is anti-histone antibody. Anti-histone antibody is actually associated with drug-induced lupus. Then we have antiphospholipid antibody. In antiphospholipid antibody, actually three tests are available for antiphospholipid antibody. Like the first one, we have ELISA test is done for cardiolipin, and 2G1 we have ELISA test. Then second, we have some sensitive prothrombin time is also available. Prothrombin time test can be done for antiphospholipid antibody. Okay, so these are the three tests. One, ELISA for cardiolipin, and also ELISA for uh, 2G1 or sensitive prothrombin tests. So all these three tests are available for antiphospholipid antibody. Actually, this antiphospholipid antibody will predispose the individual to clotting, or it will predispose the individual to fetal loss and thrombocytopenia. Okay, it will predispose the individuals to clotting, fetal loss and thrombocytopenia. Then we have next antibody, we have anti-erythrocyte antibody. Okay, in anti-erythrocyte antibody, it is actually measured as direct Coombs test. It is measured as direct Coombs test. Then we also have antiplatelet antibody. This antiplatelet antibody is associated with thrombocytopenia.
Thank you and thank you for watching.